Hari Om everyone. We'll be starting the session with the prayer. Om Sahana Bhavatu Sahano Bhunaktu Sahaviryam Karvavahe Tejasvinavadhitamastu Ma Vidvishavahe. Om Shanti Shanti Shanti. With gratitude of the peace and thankfulness to the Supreme, we'll gently open our eyes with beautiful breath. Hari Om everyone. Myself, Dr. Vaishali. I am Assistant Professor and Therapist at the renowned institute in the Central India, that is Paramanand Institute of Yoga Sciences and Research in Indore, MP. I've been associated with the institute for past 4 years and working with the patients and seeing the tremendous and magical changes in the patient, which got me into the field from the medical science. I am a professional physiotherapist. I've been practicing physiotherapy since 7 years, and for 4 years I've been practicing in the yoga field with the conjugation of physiotherapy and yoga therapy. We'll be moving further with the topic. 21st June 2022 is celebrated as International Yoga Day. The International Yoga Day 2022 theme is Yoga for Humanity, which perfectly portrays how during the peak of COVID-19 pandemic, yoga serves the humanity in reducing the suffering. The theme also aims to highlight how even in the post-COVID geopolitical scenario, yoga can play a major role in bringing people together with compassion, kindness, build resilience among people, and foster a sense of unity. Yoga is a practice that brings joy, health, and peace from within, and it deepens a sense of continuous connection between an individual's inner consciousness and the external world. So we'll be moving further with the topic today. The topic I will be speaking on, that is attention deficit hyperactivity disorder, that is ADHD and yoga. So when we start with the discussion of this topic, we know nowadays that children are suffering from ADHD in most of the countries. We'll try to understand that what ADHD or attention deficit hyperactivity disorder is. It is a chronic condition including attention difficulty, hyperactivity, and impulsiveness. ADHD often begins in childhood and can persist into the adulthood. It may contribute to low self-esteem, troubled relationships, and difficulty at school or work. There are different categories of ADHD that will be stated under behavioral change, cognitive change, change in the moods, and also there will be common signs. When we talk more about the behavioral changes or the behavioral signs, you can see aggression, excitability, fidgeting, hyperactivity, impulsivity, irritability, lack of resistance or persistent repetition of the words or action. Now, these can be the very common signs what we can see in toddlers or in children, and also these signs you can see in people who are working or they have a very long monotonous routine, or they are mentally or emotionally depressed, or they will be having some other psychological issues. When we talk about the cognitive conditions, absent-mindedness, difficulty focusing, forgetfulness, problem paying attention, or short attention span. In mood or in the behavioral changes, we can see the person will experience anger, anxiety, boredom, excitement, or mood swings in very short span of time or for no reason. Also, there are other signs in the common, that is depression or learning disability. When we talk about signs and symptoms of the ADHD, it is normal for children to have trouble focusing and behaving at one time or other. However, children with ADHD do not just grow out of these behaviors. These symptoms continue, can be severe, and can cause difficulty at school, at home, or with friends. A children with ADHD might have other signs and symptoms, that is, daydreaming a lot. They will immediately, if they are paying attention or they are sitting in a class or working, and suddenly they will be traveling into the some other world or with different thoughts, just opposite with the work what they are paying attention with. They will quickly forget or lose things a lot. They will find difficulty to memorize or remember the things or the talks what they would have done just before a few hours or couple of minutes. The student or the children or people can have the other signs like squirm or they get fidget. They keep on talking too much. They make careless mistakes or take unnecessary risks. They have a hard time resisting temptation, have trouble taking turns, and have difficulty getting along with others. When we talk about the common types of ADHD, there are three different types of ADHD depending on which types of symptoms are strongest in an individual. First, that will be predominantly inattentive presentation. It is hard for the individual to organize or finish a task, to pay attention to details, or to follow instructions or conversations. The person is easily distracted or forgets details of daily routine. The second type will be predominantly hyperactive impulsive presentation. The person fidgets and talks a lot. It is hard to sit still for long, for example, for a meal or while doing homework. Smaller children may run, jump, or climb constantly. They will find difficulty to sit at one place and be focused on the work. They will be more restless and they will find difficult to focus on their work. The individual feels restless and have trouble with impulsivity. Someone who is impulsive may interrupt others a lot, grab things from people, or speak at inappropriate times. It is hard for the person to wait their turn or listen to directions. A person with impulsiveness may have more accidents and injuries than others because their mind is more uh, occupied with other thoughts or with other actions that they find difficult to focus at the work what they are doing. The third type will be the combination of both. That is, the person may have the symptoms of predominantly inattentive presentation as well as the hyperactive impulsive presentation. Because symptoms can change over time, the presentation may change over time as well. The common causes of ADHD, if we see, first will be working with the brain anatomy and function, a low level of activity in the parts of the brain that control attention and activity level may be associated with ADHD. Genetics and heredity, significant head injuries, prematurity, prenatal exposures to use of alcohol or nicotine, in very rare cases, toxins in the environment may lead to ADHD. Today, here we will talk about the impact brain waves, how the brain wave works, what are the types of the brain waves, and what are the actions. And in further slides and discussion, we'll try to understand that what is the action of the brain waves into the yogic techniques or yoga therapy tools for practicing and helping the patient to come out of the ADHD sign. So, very first, when we talk about that is delta brain waves, the frequency of the brain waves is 1 to 3 hertz, are the slowest, highest amplitude brain waves, and are what we experience when we are asleep. Delta waves are characteristic of sleep. There was little delta during the relaxing and meditative task, confirming that non directive meditation is different from sleep. The second wave we see that is theta brain waves. The frequency of theta brain waves is 4 to 7 hertz. Brain waves are represent a daydreamy, spacey state of mind that is associated with mental inefficiency. At very slow levels, theta brain waves activity is very relaxed state, representing the twilight zone between waking and sleep. During meditation, theta waves were most abundant in the frontal and the middle part of the brain. The third type of the wave, that is your alpha wave, the frequency is 8 to 12 hertz, are slower and larger. They are associated with a state of relaxation and present the brain shifting into an idling gear, waiting to respond when needed. If we close our eyes and begin picturing something peaceful, there is an increase in alpha waves. Alpha waves were more abundant in the posterior part of the brain during meditation than during simple relaxation. They are characteristic of wakeful rest. The fourth type of the wave is beta waves. The frequency will be 13 to 38 hertz, are small, faster brain waves associated with a state of mental, intellectual activity and outwardly focused concentration. This is basically state of alertness. Beta waves occur when the brain is working on goal-oriented tasks, such as planning a date or reflecting activity over a particular issue. EEG showed few beta waves during meditation and resting. Now, when we talk about meditation or resting state, the person having or practicing the meditation or practicing the yogic techniques, maybe guided meditation or being blissful meditation, there is the more action of the alpha wave and as well as the theta waves, which gives the state of relaxation and calmness, but yet in the state of alertness. Whereas when a person is active and ready to do the task, the beta waves will be more active. Now, patients who are experiencing ADHD, they will find difficulty to focus and there will be fluctuations between the beta waves, the alpha waves, and the theta waves. The fifth type, that is your gamma brain waves, the frequency that is 39 to 42 hertz, are the fastest and most subtle brain waves. Gamma rhythms modulate perception and consciousness. So, when a person practices meditation and is about to reach or crossing over the koshas from the Manomay kosha, going towards Vijnanamay kosha and traveling towards the blissful state or Anandamay kosha, the gamma waves will be into the action. In many researches, it is observed that most patients with ADHD brain have a common brainwave pattern that consists of an abundance of slow delta and theta brain waves and shortage of fast beta waves. This means that they have a high theta to beta ratio which can explain that the brain mostly stays in the range of state of insufficiency and state towards sleep. The National Institute of Mental Health trusted source found that the certain sections of the brain in people with ADHD mature slower than those without ADHD. This delays occurs mostly in the frontal lobe of the brain, the part of the brain that is responsible for impulse control, concentration, attention, and planning. Even though certain sections of the brain are associated with ADHD behaviors, how the parts of the brain communicate with each other may also be important in people with this condition. Someone with ADHD might show impairments related to cognitive, behavioral, and motivational functioning. When we talk about the yogic principles or the yoga therapy for ADHD, what we practice at the Paramananda Institute of Yoga Sciences and Research, the common principles are balancing asanas or crossing over asanas. That means, for example, with your left hand, if you touch your right knee, or with left hand, if you touch your right shoulder. The asanas which have more inclusion of the crossing over of the asanas and the body parts will be beneficial for the ADHD. The mudras like Jnana Mudra, Keychiri Mudra, Bhairavi Mudra, and Hakini Mudra. The mudra signs, when we talk about the mudras itself, has its own signs. They work on different principles because in your hand you will be having your five bodies, you will be having your five elements, you will be having your five vayus or panchapranas. Also, there are the location of the chakras in your palm. If we talk in relationship with the Chinese medication, the ki and chi energy will be working on with your palms. The meridians come into the contact. So it is said that your fingers, they continuously tend to lose the energy. So when we gently make the connection with the fingers, maybe in different positions, the energy returns back to in your body and you can work more better way with the improving flow of the energies and clearing out the blockages of the nadis, which in result will help a person to work on the chakras more efficiently. Other than the mudras, when we practice pranayamas like Anulom Vilom, Brahmari Pranayama, or Nadi Shodhana, when we talk a little bit about pranayamas, we say if we try to relate that with anatomy and physiology, the controlling center of respiration is your medulla oblongata, the part of the brainstem in your brain. The medulla oblongata will be controlling the involuntary rhythm of the respiration. But when we practice pranayama, we are voluntarily controlling the pattern of breathing or the rhythm of the breathing, and the function of the cerebellum or the function of the brainstem is shifted majorly to the cerebrum, which is responsible to control the voluntary actions. In further slides, we'll try to understand that how the brain mapping is done or how the connection and the bridges are formed with the techniques of yoga. When we talk about the basic Panchakosha principles or the theory in yoga, we have five bodies. That is the first one, that is your Annamaya Kosha, your physical body. The second one will be your Pranamaya Kosha, that is your energy body. Third is your Manomaya Kosha, mind body. Vijnanamaya Kosha will be the intellect body or the intuitive body. And Anandamaya Kosha will be the state of your bliss. So Annamaya Kosha is generally comprised of all the five elements, that is your Agni, Vayu, Akash, Prithvi and Jal. Or we say we will be having space, air, water, fire and earth. When we talk about the elements, the subtlest element we have space and the gross element is the earth. When we talk about Pranamaya Kosha, this kosha is the energy body. Here will be the more actions of the chakras, the nadis, and the energy. The action of prana, the life governing force or the life governing entity. Now, there are many concepts about the prana that some people say that prana is the oxygen what we inhale. But prana is more than the oxygen what we think. As we know that oxygen is dealt with the Annamaya Kosha or the physical body, when we try to understand the prana in respect with the pranamaya kosha, it will be dealing more with the energy than to the physical one. Whatever changes or whatever functions are being governed in your body, the information or the action is controlled by the prana. So we say that prana is the life governing force, the connection between the two cells in your body, the information transformation, or if we say that the similar type of cells, they combine and it make tissue. Similar type of tissues will be making organ. But how does one cell knows that the cell next to that is with the same qualities or with the same function? There we say that that is the cellular intelligence. Every individual cell knows that what they want to absorb, what they want to utilize for their normal function, and what waste they have to give out, with which type of cell they have to work together to make an tissue. So that information or the knowledge of the cell itself, that is called as cellular intelligence. And when cell combines and start performing the action, that action or functions are governed by the prana. So here we can easily understand that prana is not only the oxygen what we inhale, it is more dealing with the sense and the action of the energy which is controlled by the pranamaya kosha. The third body here we see that is manomaya kosha, the mind body. If you see here, the actions of the waves will be working here. The superconscious mind, then there will be deep subconscious mind, then subconscious mind, and then the conscious mind. Now, here, if you see between the Annamaya Kosha and Manomaya Kosha, we have Pranamaya Kosha. So, the Pranamaya Kosha, it creates the bridge between Annamaya Kosha and Manomaya Kosha. The fourth body we have is the Vijnanamaya Kosha, the intellect body. Here, there will be the more action of healing, solutions, and intuition. And when we talk about the Anandamaya Kosha, that is the state of the bliss, bliss is the only word which do not have any opposite word. This is the state of the bliss where you will only feel the state of joy or happiness or when you're more relaxed and calm and bliss. There is absolute bliss, co-creator, there is peak experience, creativity. These all bodies will be governing our whole body and the human life. When we talk about the chakras, chakras itself is the energy wheel which are located at the different locations, which is depicted in this slide. You can relate here. And chakras are also related with the endocrine glands in your body. Now, here, if you see, the chakra is again the entity of your pranamaya kosha. And when you relate it with the endocrine glands or the glands which releases hormones, those are the part of your annamaya kosha. Now here we can easily understand that the chakras are helping to connect your physical body down with the pranamaya kosha and the manamaya kosha and moving further. There are many cases, or I have seen many patients in this state that they are physically active, or there is no negative test, or whatever test they come across, or they get up the test, all the results are positive and good. As such, they do not have any negative aspect or effect of the condition or the pathology. But if a person comes to you and say that whatever I feel, I'm not able to speak out, then that is the disturbance of your Vishuddhi chakra, the chakra in your throat. So every chakra has its own governing action and the governing functions, which can show if the energy of the specific chakra is disturbed, that can show the disturbance in the physical and in the mental body. Now, here when we talk about Aadhees and Vyadhis, the Aadhees are the mental conflicts and the Vyadhis are the physical disturbances. So this simple chart and the flow chart will give you an idea about the how mental conflicts or the mental disturbance can cause disturbance into the physical body. That means if there is disturbance in the third kosha, that is Manomay kosha, the negative effect can be seen on the Annamay kosha. That means the bridge between the both. That is your Pranamay kosha is also getting disturbed. It is said in the text and in the researches that most of the diseases first come in your mind and then it starts showing the signs in your physical body. So we'll try to understand what are the relationship with that. So first, if we see the Manomay kosha, where the conflict starts, will gradually disturb the Pranamay kosha. Now, when we talk about the pranas, we have 5 pranas in the body. That will be Vyanavayu, Udanavayu, Pranavayu, there will be Samanavayu and Apanavayu. So when the Pranamay kosha is disturbed, these 5 other pranas can also get disturbed. So very first, when there is disturbance in the Pranamay kosha, there will be disturbance in the Varishta prana, the major or the primary prana, which controls the action of the other pranas. When there is disturbance of the Varishta Prana, that will show the disturbance in the ANS, autonomic nervous system, which will be having the direct effect onto the bowel contractility or the disturbance in the digestive function, because ANS or autonomic nervous system will be having the subflows or sympathetic and parasympathetic nervous system, and to understand these both systems is very important because they control and relate with the psychological conditions. Coming back to the slide, when the Varishta Prana disturbs, it will be disturbing the Samana Vayu, and the disturbance of the Samana Vayu can cause overdigestion, that is Atijirna, non digestion, that is Ajirna, and wrong digestion, that will be Kujirna. Apart from this, when these all are digestive disorders, there will be the physical ailments. When a person's digestion system is not working well or the digestive function is not functioning properly, the signs and symptoms what we can see in the patient, that is abdominal pain, maybe bloating or discomfort or stomach ache, and that can directly be connected by the IBS, irritable bowel syndrome. And there can be different subtypes of the irritable bowel syndrome, maybe diarrhea dominant, constipation dominant, or that can be the mixed type. If a patient is experiencing digesting problems or eliminating problems, then there is also the disturbance of the apana vayu. So here we can see that from the mental conflict, the pranamaya kosha is getting disturbed. That will be showing the other signs and the changes in the physical body, and in result, there will be disturbance in the annamaya kosha. Here we can clearly see that our annamaya kosha, our pranamaya kosha and manomaya kosha are directly connected to each other. As a physiotherapist, when I was handling patients few years back, I have seen many patients with the accidents or RTA, road traffic accidents, and paralysis. So when we used to work physically, only assisting the patient with their hands and limbs and movements, but we never thought about what would happen if they had some negative thoughts in the mind. The person or the patient is having thoughts like, I am bedridden, I am burden on the family, or now I am not functioning well, or my body is not supporting me, creating the negative loop of the thoughts. And that started affecting the process of healing or the process of treatment, and gradually that got delayed. So it is very important to understand in any medical field or in yoga therapy, that is the star key action to understand that the mental disturbance or the conflicts can directly affect the physical body and can have the direct relationship onto the healing action. Now, when we come on to the yoga practices, when we talk about yogasana, these are the special patterns of the postures that stabilizes the mind and body throughout the static stretching. Asanas make the body relaxed, strong, light and supple, free of aches and pains, and this in turn brings about emotional and mental calmness and confidence. This is also mentioned in the Patanjali Yoga Sutra, that is Sthiram Sukham Asanam, means one who is steady, stable, and comfortable in any posture is asana. Nowadays, the technique of the yogas or the principles, what is accepted by the people or this era is that if you're performing asanas or if you're practicing asanas and your asanas is crisp and clear and you attain the perfect posture, then you're practicing yoga. But here I would say that if you do not understand what panchakoshas are, what panchapranas are, what is the action of the chakras, nadis, energies, your bodies, about the elements, about the Sankhya Yoga, the origin of the universe, how Purush Prakriti works, how the action of the Purush and Prakriti makes and forms the gross element of the universe, then I would say that you're only practicing the exercises and not the yoga. When we come on to the pranayama brings new level of the awareness by stopping or restraining distractions of the mind. This practices reduced thoughts, conflicts, etc. in the mind to minimum and thus increase the concentration memory along with the wonderful physiological advantages. In yoga practices, we generally prefer to close our eyes. Why do we want to close our eyes? Our eyes are very important, one of the sense organ which is responsible for vision and perception around us. But it is said that your eyes utilizes 22% of the energy of your entire body. So when we close our eyes, our body, our mind and our energy is being utilized in more towards the positive aspects. We can travel within us and we can understand and we can know that what we are and what is the action of us in this world and in this life. Coming on to the conscious relaxation techniques. By relaxation, one can release tension both in mind and body for a period of time to allow complete rest and revitalization. Stress and emotional turmoils begin to evaporate during relaxation. Meditation or dhyana. This is the practice involving control of the mental functions which start from the initial withdrawal of the senses from external objects. The basic principle of meditation is to develop internal awareness. When we talk about the senses or the organs in relationship with the physiology and philosophy, we say that manas is controlled by your senses. Manas do not have the intellectual capacity to understand whether that is right or wrong. That action, the intellectual action, is done by the buddhi, which gives you the understanding about right and wrong or true and false. So, when we practice pratyahara, you're cutting off the action of the senses, whether be physical senses or the senses which are governing your mind and thoughts. Then that will be cutting off the action of manas, which can give you the duality or the conflict, and you will be working with your buddhi with the correct and proper intellect. When we practice yoga, the studies show that it decreases the level of the cortisol and the blood glucose. Cortisol is one of the hormone which is secreted by your body to combat the situation of the stress when there is adrenaline rush and the activation of sympathetic nervous system. The action of cortisol is that it increases the blood glucose level and it increases the blood pressure. So when we practice yoga with the conjugation of asanas, pranayamas, meditation, mudras, dhyanas, that helps to reduce the stress in order will be reducing the secretion of the cortisol and in result will be reducing the blood glucose level and the hypertensive state. Yoga significantly decreases the heart rate and systolic and diastolic blood pressure. Studies also suggest that the yoga reverses the negative impact of stress on the immune system by increasing the level of immunoglobulin A as well as the natural killer cells. So, when your immunity is strong, your body is easily fighting up with the pathologies or with the conditions or with the germs or the bacteria or the viruses which can affect your body negatively. While the precise mechanism of action has not been determined, it has been hypothesized that some yogic exercises cause a shift towards parasympathetic nervous system dominance, possibly via direct vagal nerve stimulation. When we talk about the benefits of yoga for stress management, that is union of body, mind and soul, we'll be working onto the all five koshas to connect and work together. It will help to improve sleep, increase energy, it will help to increase concentration and focus, will experience deep relaxation, boost in confidence and inner healing. And this is what required for the patients experiencing ADHD. How yoga works. We'll try to understand that with a simple flowchart. The first stage is that when you practice kriyas, asanas, pranayama, and dhyana, it will start balancing your endocrine system and nervous control. In result, that will increase the mind and body coordination, and when there is a better mind and body coordination, it will gradually start relaxing and calming, and the person will start feeling of freshness, and the end result of this will be the healthy, happy and harmonious life. Now, there are few techniques in yoga therapy which was also the part of our culture, about the Indian culture. We'll try to understand what these are. Now, first, when we try to understand that how our brain works or what are the segments or the parts of our brain. When we talk about the homunculus, if you see the picture of this person, is not at all relatable with the physical body what we see of a person. This picture is the distorted representation of a human body based on a neurological map of the areas and proportions of the human brain, which are dedicated to processing the motor functions or sensory functions for different parts of the body. Now, there are two different types of homunculus, that is motor homunculus and sensory homunculus. The motor homunculus represents a map of brain areas dedicated to motor processing for different anatomical divisions of the body, whereas the sensory homunculus represents a map of brain areas dedicated to sensory processing of different anatomical divisions of the body. Now, here when we try to understand these segments, the post gyrus, that is called as the somatosensory cortex, and that is responsible for the somatosensory impulses. The term somato you can understand by the skin. So, whatever information we receive from the external environment, what are the sensations, what our brain perceive, will be in the segment of somatosensory cortex, the blue color band that is posterior to the motor cortex. The precentral gyrus, which is anterior to the sensory cortex, is responsible for motor impulses. Now, why we are studying this or why do we need to understand? because now there will be the action of the mudras and the pranayamas and the asanas will be understanding further. Now, how this correlation between sensory and motor cortex works. If we take a simple example that when a feather is touching the toe, in response you wiggle your toe. Now, when the feather touched, the sensory impulse went into the post-central gyrus, that is of your sensory area, that created a connection between the pre-central gyrus and the motor area, and that gave the impulse to gently wiggle your toe if you are feeling ticklish due to the feather touch. When we talk about the hemispheres, our brain has two hemispheres, left and right hemisphere. The left hemisphere is more logical and has more skills, and it is responsible for language and grammar and memory and is analytical. But when we talk about the right hemisphere, it is more of the creativity, feelings, concentration will be more photogenic memory, imagination will be more arts and skills. Our body is controlled by your brain in contralateral aspect. The left side of the hemisphere will be controlling the right side of the body, whereas the right hemisphere will be controlling your left side of the body. Asanas which have crossing over the left and right, can see the examples and the pictures, will be improving the contralateral control of the brain. The effects of the crossing over asanas. Crossing over asanas or asanas in which you touch your body, like in Namaskar Mudra or holding yours or making any hand mudra or performing pranayama, makes different connections in the brain and gets activated. Now, if you see, this is, I try to explain with a simple diagram. When we join our hands in Namaskar Mudra, when we thought about joining the hands, first, the motor center or the motor cortex, which is responsible or which is related with the hands, they came together. And as soon as you touched your palms felt each other. Both the palms could feel the connection. So, that connection, the sensory cortex, which is responsible, or the area which is depicted for your hand, that got activated. So, gentle Namaskar Mudra with the vision or with the thought, we can see, okay, we have just connected our hands in Namaskar Mudra, how that can improve the connection in the brain. In this picture or the diagram, you can easily and clearly see that it is creating the connections between both the cortex, the anterior and posterior connection. When we gently make the Nasika Mudra for practicing pranayama, in Nasika Mudra, you will be gently flexing your index and middle finger. We keep in the front and we control the nostrils with the action of our thumb and our ring finger. So here you can see the motor cortex, which will give order to make the Nasika Mudra and place on your face or around your nose to control your breath and practice pranayama. There will be the other bridges which will be connecting and which will be formed in the motor cortex, will be connecting to the sensory segment of the face. Now, Keychiri Mudra, we'll more talk about the Keychiri Mudra. This is a simple technique of rolling the tongue and connecting to the roof of your mouth. That is, the beginners can feel that the point is the junction of sensory, the connection of your soft and hard palate. So here you can see that when you thought of performing the Keychiri Mudra, you will gently roll up your tongue. You touched the roof of your mouth, and as soon as you touched, the area in your sensory cortex got activated, and the bridge between the both segments are formed. And the bridges are formed by the connection of the neurons. The second technique, that is also called as Thopu Karanam or the brain power yoga, or of course the punishment what we used to get in the school time if could not complete the homework or could not study well. Now, what is brain yoga or power brain yoga? Super brain yoga has enabled people to achieve mental, physical, and spiritual well being. With the inherent yogic practices, one can attain a higher state of awareness and improved bodily function along with a coherent spiritual connection. Followed by people of thousands of years, it is among the most popular practices and routine to establish control over mind, body, and soul. Thousands of years ago, traditional brain power yoga was called as Thopu Karanam. Thorpe means hand and Karanam means ears. Thopu Karanam is well known yogic process which is believed to improve the concentration of the mind and to activate the parts of the brain which then helps in one attaining a higher sense of alertness. We say that Lord Ganesha is the Lord of the intelligence, has the power of intelligence. How we can understand that? We'll try to understand now. The devotees pray for pardoning themselves for any error or mistake made by them which is caused by bad intent. They stand in front of the Lord Ganesha. As you can see, a young boy is holding the ears in the technique of Thopokarnam in front of the Lord Ganesha. What action does this has? First, when you're standing in front of the Lord or in front of the Supreme, that creates the spiritual connection. When you hold your ears, you have the feeling of understanding and accepting the mistakes what you have made, learning from the mistakes and becoming a better human. When we try to understand the scientific findings behind this, the ventral view of the brain seen from the underneath shows the clear correspondence between the Ganesha's face and the pons, medulla, and cerebellum. If you see here the picture of Ganesha and the segment of the brain is depicted, and you can directly relate with the organs and the parts of the Ganesha's face. The face of Ganesha corresponds to the pons. The medulla represents the trunk of the Ganesha. The roots of the trigeminal nerves represent the eyes of the Ganesha. A group of nerves at the pons represent the tusk of Ganesh. The cerebellum constitutes the ears. At the part of the brain develops the arts, science, intellect, and wisdom, which is corresponding to the power of the Lord Ganesh. It has gained support from the various researches and studies. A case study done by the Kotter Baar in 2007 with administrating the super brain yoga revealed a great result in the case of ADHD and many others. Yoga research for children with ASD has demonstrated improvements in stillness, following directions, emotional expression, and social interaction. There are many more research papers on this topic and have found various and amazing results. So, here we can say that if a patient or a person or a child is experiencing from ADHD, our yoga science has many yogic techniques which can help a person to come out of those Aadhees and mental conflicts without medications and using own body energy and own ideas and intellect to come out of the state of ADHD. Yogic intervention, along with the practice of super brain yoga techniques, significantly increases the level of the alpha waves. According to a research by Cornell University of New York, mental health problems affect 1 in every 5 young people at any given time. That is a huge number, since to face all the problems such as strain, tension, depression, anxiety, and many more. For any type of mental as well as the physical disorders, yoga, along with asanas, super brain yogic technique, and Surya Namaskara, sun salutation, proves it best of all. Physiological changes. This is a physical representation of a primary motor cortex. That is the portion of a human brain directly responsible for physical movements as well as the input of the sensory information from the whole body. The crisscrossing of the hands to the opposite earlobe enables different parts of the sensory motor homunculus to be connected as the neurons associated with respective areas cross both hemispheres of the brain will be firing at the same time. It is often said in neuroscience that neurons that fire together, they wire together. Hence, we can understand that this practice could potentially help induce health changes in neuroplasticity. How it is performed, the super brain yoga or the Thoppu Karnam. You will be holding your earlobes in the cross form. Make sure that your thumb comes anteriorly or in front and your fingers go at the back of your earlobes. Inhale through your nose as you sit down, exhale through the mouth as you come up. Practicing this every day for at least 10 to 12 rounds and gradually increasing it to 15 minutes. Such forceful exhalations have been reported in the studies to enhance the central neuronal processing. Here again, one more yogic technique comes, what we call as Mukha, which again activates your parasympathetic nervous system and gives the state of relaxation, reduces stress, anxiety, and other related issues. That is the Mukha. You inhale from your nose, you gently exhale through your mouth, and that instantly gives you the state and feeling of relaxation and calmness. The benefits of the super brain yoga. It energizes the brain by synchronizing our alpha brain waves. The practice eliminates stress and encourages mental stability. It promotes healthy cognitive function, strengthening the immune system and promoting fast healing due to the increase in the alpha wave activity. If you see that it is the alpha wave activity, the fast healing action, that is the action or the work of your manomai kosha. Again, here the bridging will be doing its job and the action to heal. When we talk about pranic healing, you're utilizing your own energy to heal your own self, reprogramming our state of our inner consciousness. It also improves the intelligence, creativity, and overall performance, synchronizing the right and left hemispheres of the brain. A more energized and active mind, increased inner peace, relief from anxiety and other mental health challenges, a more stable sex drive, physical cleansing, more energized chakras, greater psychological balance, proper brain functionings, and there are many more functions to note. There's one more last technique I would like to explain, and I would ask you to practice that with me. We'll try to understand the effect of this technique. Keychiri Mudra and Brahmari Pranayama being combined together. Now, when we understand what is Keychiri Mudra, in Keychiri Mudra, if you see in the picture, the tongue is touched up again onto the roof of your mouth. When you touch it, you can see that the tongue is directly related with the segment of your pineal gland. Along this, that is the location of your pituitary thalamus, hypothalamus glands, resulting the relaxation and calming of the mind. It also activates the third eye chakra or Agya chakra, and it is directly related with the above glands. Now, here when we see that when you draw an imaginary line from where the tip of your tongue is touching upwards and another imaginary line from the center of your eyebrow, the location of your third eye, going backwards, the point where these two lines will be intersecting in your brain, that is the location of your pineal, pituitary thalamus and hypothalamus. And we all know that what will be the actions of these glands if they are working onto the healthier state. How does the Brahmari Pranayama works? When we talk about the Brahmari, why do we need to insert our thumb inside the ear? The thumb acts as a transmitter of the vibrations. Now, here we know that our ear throat is connected with a simple eustachian tube. So, when we start brahmaring or producing the humming wee sound from the throat, it might get lost out of the ears. So we block our ears with the thumb. Our thumb will act as a transmitter, will receive the vibrations and will transmit to your fingers. And when you place your hands on your face in Shanmukhi Mudra, the fingers will be transmitting the vibrations. Fingers receive the vibrations from the thumb and transfers the vibration to the desired locations. When combined with Keychiri Mudra, keeping the teeth apart, lips will be closed, applying the Keychiri Mudra and then practicing the Brahmari Pranayama has the greater impact. Tongue now here will be acting as a transmitter of the vibrations till your respective glands and the center of your brain and will be activating the glands, which in results activate the parasympathetic nervous system and can have the calming effect onto the ADHD. So for 1 minute or two breaths, we will start the practicals before ending the session. I would like that you please kindly take out 1 or 2 minutes to practice this technique and yourself you can feel the changes at the same point. So if you're wearing glasses, you can remove your glass. Inhale deep. Exhale. Relax your mind and body. Do it again. Inhale deep. Exhale. Relax your mind and body. Keeping your eyes closed, bring your awareness on your breath. Now gently roll up your tongue. Touch onto the junction of soft and hard palate onto the roof of your mouth. Keep your lips closed. Let your teeth stay apart. Do not connect your teeth together. Gently insert your thumbs in your ears. Place the index finger on the eyebrows. Make the cup with your middle and ring finger. Gently place on your eyes and place pinky fingers below your cheekbone. Make sure that you are performing the Brahmari or humming with the open epiglottis. Inhale deep. If you have performed it correctly, you can feel the vibrations rising from your Anahat chakra, from your heart chakra rising up, connecting your Vishuddhi chakra, rising up, connecting your Agya chakra, and you can feel the energy rising in your body towards the upper aspect as the water rises inside the trunk of the tree. Enjoy the technique, feel the changes, and you can see the positive results in the practice of 10 to 15 breaths. When you are done with the technique, gently rub your palms together. Make cup of your palms, keep on your eyes. We will gently bow our head down, keeping the feeling of gratitude in our mind, in our heart, and our soul. We will be thanking the Supreme. We will feel the connection of the Supreme with our own consciousness. We will thank, will be grateful for such beautiful and healthy body, beautiful life, offering us food and beautiful nature. Being grateful, we will gently massage our face, we massage our head, we will gently tap our body, we'll transmit the energies in our whole body. With deep inhalation, you can gently open your eyes. Hope you all enjoyed the technique. Before ending up the session, I would here conclude my speech and my talks that yes, yoga has the power to heal a person physically, mentally, spiritually, and emotionally. There have been many researches done to understand the connections and the studies. And I feel very grateful that we are the chosen one for this field and help the humanity. Rest others are the part and the aspect of this beautiful world, but humanity should be the key to let the life be governed with joy, love, peace, bliss, and of course, healthy mind, body, soul, and spirit. The conclusion here will be the yoga is an holistic approach. Correct yogic techniques help to reduce the signs and symptoms of the ADHD. Through yoga, one can live a better and stable life physically, mentally, and spiritually. Yoga is not related to any religion. Instead, it is the science which helps to understand the origin and aim of life, also helps to live life peacefully. I will end up my session. Hari Om.